So today we'll be doing a medication check and administration. So I'm going to wash my hands and then I'm going to verify the medication or the MCP order. So my patient's name is Ren Harumi. The patient ID is 160011180. The date of birth is March 3rd of 1983. The only allergy is Demerol. Today's date is February 10th of 2020. I will be administering a regular insulin injection. The concentration is 100 units per 1 milliliter. We'll be administering it subcutaneously to the abdomen. We are administering this because my patient's blood sugar is 256, and I will be giving 6 units because it is within the range of 251 to 300, and that is what the order specifies. It is currently 11 o'clock in the morning. The patient has had no previous injections on this 24-hour MAR, so it is safe to administer. So now I'm going to be gathering my supplies. So I'm going to verify. My patient's name is Ren Harumi. I am in his drawer, so the date of birth is 03/03/83. The ID is 160011180. So from his drawer, I'm going to be taking a vial of regular insulin. It is 100 units per milliliter, which is what the MAR says. Regular insulin, 100 units per 1 milliliter. The bottle is intact, it's not broken, and it's unopened. The expiration date is May of 2026, so it is not expired. I will also be getting an insulin syringe. Okay, the insulin syringe is intact, unopened, and sterile. The expiration date is November 30th of 2023, so it is also not expired, so it is safe to use. I will be getting 2 alcohol prep wipes. They are intact and not opened. I will be getting 2 clean gloves. And I have tape so that I can verify that the syringe I'm bringing my patient is the correct one for him. So my med math has already been done for me. It does not need to be done in this particular case. So the units that we will be giving today is 6 units of regular insulin. I know this because the blood sugar level that has been tested in my patient is 258, and my MAR says that if the blood sugar level is between 251 and 300, that I am to give 6 units. So I'm just going to double verify. The blood sugar level is 258, and my MAR says that from 251 to 300, I'm to give 6 units of regular insulin. So I'm going to be doing my first medication check. My patient's name is Ren Harumi. The patient ID is 160011180. The date of birth is March 3rd of 1983. The only allergy is Demerol, and we are giving regular insulin today, so that should not be an issue. Today's date is February 10th of 2020. I will be giving an injection of regular insulin, 100 units per 1 milliliter. So here in my hand, I have regular insulin, and the concentration is 100 units per 1 milliliter. We will be giving this subcutaneously into the abdomen. I will be administering 6 units because my patient's blood sugar is 258, and from 251 to 300, I am supposed to give 6 units of regular insulin. The time is 11 o'clock in the morning, and my patient has not had any previous injections of insulin, so it is safe to administer. So now I'm going to do my second medication check. So my patient is Ren Harumi. The patient ID is 160011180. The date of birth is March 3rd of 1983. The only allergy is Demerol. Today's date is February 10th of 2020. It is 11 o'clock in the morning. My patient has had no prior injections, so it is on this 24-hour MAR, so it is safe to administer. I am going to be giving Novolin regular insulin 100 units per 1 milliliter. It is a PRN medication. I am checking that I have regular insulin 100 units per milliliter right here, and that is what I have. It matches. I will be administering 6 units of insulin because my patient's blood sugar is 258, and from 251 to 300, I'm supposed to administer 6 units. We will be administering this subcutaneously into the abdomen. So now I'm going to prepare my medication. So I am going to take my medication and an alcohol prep wipe. I'm going to open this, clean off the top, and I'm going to leave the prep wipe on top so that I know that my container has been cleaned. I'm going to open my syringe, discard that. I'm going to take the safety cap off, and I am going to pull up 6 units of air into the syringe to inject into my medication. Okay, taking the alcohol wipe off. Needle is going in. I'm injecting my 6 units of air. My needle is below the water line, so it's okay for me to pull up the medication. I'm overshooting so that my air bubbles will not get in. Okay, so I have 6 units of insulin prepared. I'm going to take my needle out, and then I'm going to do a one-handed recap. And then I am going to ask you to verify how much is in the needle, or in the syringe.
6.
Perfect. So my syringe is prepared. I am going to take my tape and make a label for my patient. So my patient's name is Ren Harumi. I am giving Novolin regular insulin, and the concentration is 100 units per 1 milliliter. I am going to be administering 6 units, and today's date is February 10th of 2020. It is 11 o'clock in the morning. I'm going to initial this. So now my tag is prepared, and I am going to put it on my syringe. Okay, so my syringe is prepared to take into my patient's room. So I'm going to take my MAR, my alcohol wipes, and my gloves, and a pen for documentation into my patient room. So I'm going to knock and then wash my hands. Hi there, my name is Kaylee. I'm going to be your student nurse today. And then I would ask how my patient is feeling. And then the first thing I would do is ask my patient to verify their name and date of birth. So my patient says that the name is Ren Harumi. The date of birth is March 3rd of 1983. So I verified my patient. So today we're going to be giving you an insulin shot into your stomach because your blood sugar is a little high. So, can you tell me where you are today? Patient says the UK College of Nursing. And what is the next holiday? The patient says Valentine's Day. So I verified that his level of consciousness is he is oriented ×3. So now I'm going to be doing my third med check. So my patient's name is Ren Harumi. And then I'm going to verify against his ID. His ID number is 160011180. The date of birth is March 3rd of 1983. And then I would ask, do you have any allergies? He tells me his only allergy is Demerol, and I'm verifying that in the chart. His only allergy is Demerol. Today we're going to be administering regular insulin, so that should not be an issue. Today's date is February 10th of 2020. I am administering a PRN medication, which is Novolin regular insulin. It is 100 units per 1 milliliter, which is what I have prepared here. I have 6 units prepared in my syringe, and I'm just double checking that one more time. And I'm giving 6 units because my patient's blood sugar is 258, which is in the range of 251 to 300, which is what my MAR tells me to give. I am administering this subcutaneously to the abdomen. It is 11 o'clock in the morning. My patient has not had any previous injections on this 24-hour MAR, so it is safe to administer. So now I'm going to wash my hands and put on my gloves. And then since we will be giving the injection to the abdomen, I'm going to inspect the area. So I see that the abdomen is one color. There's no bruises, no discolorations. It does not look like there's any visible swelling. So there's no contraindication that we should not give the injection. So I'm going to take my alcohol prep wipe. I'm going to take 2 fingers and measure down from the umbilicus. I'm going to take my prep wipe and clean in small circles for that area. I'm going to leave my alcohol prep wipe there so that I know my spot. I'm going to remove the cap. I'm going to remove the alcohol prep wipe. I can pinch up 2 inches of skin, so it is okay to give the injection at a 90-degree angle. So I'm going to inject my syringe into the patient. I'm going to hold at the bottom for stability and inject slowly and steadily. I'm going to move my fingers and pull out. There's no bleeding, and I'm going to push up my safety cap and throw that away in the sharps container. I'm going to discard. And I forgot to say that before I gave the injection, I would raise the bed and lower the side rail closest to me, and then when I'm done giving the injection, I would raise both side rails and lower the bed to its lowest position. I'm going to discard my gloves, not touch the trash can, and then I'm going to wash my hands. Now I'm going to document that I gave this medication at 11 o'clock. and I gave him 6 units because of his blood sugar. So now I have documented that he got the medication. I would confirm that the patient is okay and comfortable and that he didn't need anything else. Make sure his call light is near him, and then I would leave the patient room and wash my hands.